Hi, and welcome to the ICC, or Institute for Clinical Competence at NYIT. Now, if you are interested in becoming a standardized patient or have already been hired, then this video is for you. Now, your first question might be, what exactly is osteopathic medicine? Osteopathy is a philosophy and a form of alternative health care that treats the entire patient, taking into account their medical history, their family history, and their social history. Now, osteopaths assist in the healing process by what they call manipulative or manual treatment or therapy. In other words, they use a hands-on approach to treat a patient. Osteopathic physicians are fully trained, licensed to prescribe medicine, and practice in all medical and surgical specialties and subspecialties. Now, a standardized patient, or an SP, is a person or an individual who is trained to act as a real patient in order to simulate a set of symptoms or problems. Now, when the practice of using standardized patient was first begun, they employed local actors to portray the standardized patients, given their experience in acting out certain emotions or feelings and their, of course, ability to memorize a script. However, being an actor is not a prerequisite here in the ICC, because we are here to properly train you in paid trainings and extensive role-playing. You'll be given a script and a specific case, which you will go over in detail and answer any questions or concerns that you might have. Now, the interaction between the student and the standardized patient is called an encounter. In some encounters, you are merely a body on the exam table, which allows the student doctor to practice certain clinical exams. For example, they might practice taking your blood pressure or your pulse or listening to your heart or lung sounds. In other encounters, there'll be an entire script. Well, there'll be a medical history, a social history, of course, and a complaint that you'll come in and tell the doctor about. And what they do is then the student doctor has the ability to practice taking a medical history and then performing a focused physical exam if that is included in the case. And then what happens afterwards is you, as a standardized patient, will give certain scores or feedback. And we'll get into that later when we talk about feedback for the student doctors. So now that you have completed the introduction to become a standardized patient, let's move into an actual exam room. Just click this link here and we'll go right there. Thanks for joining us.